Bismillah ar-Rahman ar-Rahim. This lecture is about ethical theories. Uh, it is a defining responsibility of a practicing physician to make decisions on patients' care in different settings. These decisions involve more than selecting the appropriate treatment or intervention. So, such physician in the middle of providing health care will face a lot of problems maybe or situations that need to make decision whether to go or to stop or to consult others. With advances in medical technology and an increasingly diverse patient population, there is a need for a clear ethical guidelines more than ever. So, as I said before, we will face in during the our practice of medical healthcare, uh, whatever, whether with patients, with administration, with people, with anything that we think it's or maybe unethical. So, what is ethical or unethical? So, ethical guidelines, we need it. In healthcare and medical practice, many situations need careful attention at decision making. For example, what if a patient refuses treatment؟ جانا هذا المريض in a serious condition or maybe a condition that needs a treatment, and the patient say, no, I will not take any medication or any sort of treatment. What if healthcare decision goes against a patient's cultural beliefs? So, what do you think? We should go against the cultural beliefs of patients because this is in the favor of his or her life, her health, his health. So, what to do? What if a member of the healthcare team makes a life-threatening mistakes? The errors, whether during the stay of the patient in the hospital or, for example, giving wrong medications or any kind of error during a surgery, and so on. Healthcare professionals face ethical dilemmas daily. This is very important. So, ethical issues in healthcare and medical practice can be challenging. So, healthcare providers prioritize patient well-being, which can sometimes mean respecting patients' wishes they may disagree with. This is one way to go with. Adhering to ethics in healthcare supports improved patient outcomes, increased trust and confidence in the healthcare system, and better overall health and well-being for individuals and communities. هذا شيء لا نختلف عليه. It's absolutely correct. So when we talk about ethics in healthcare, it will really support patient outcomes. And when we trust people within the framework that we will be introduced to during this lecture about many ways or many phases of the theories or the original or origin of ethical analysis or ethical thinking about what to do, it will give a big plus, increase trust, confidence في healthcare. These benefits are achievable when healthcare professionals have the knowledge, skills, and expertise to make ethical decisions in their daily work. So, if we don't have such knowledge as professionals, doctors, nurses, whatever, and skills, so we will be facing these dilemmas, but we don't know how to make decisions. So we need to know. Healthcare professionals dedicated to upholding ethical decision making to improve patient outcomes should consider advancing their knowledge of ethical guidelines and theories. لأن هذا نتكلم عنه. That's why we have to know some details about the ethical theories and guidelines of ethical thinking or decision making. To understand this ethical decision making, it is important to realize that not everyone makes decisions in the same way, using the same information, employing the same decision rules. Someone will say, this is wrong, you should do it the other way. And the other physician maybe would say, no, this is correct. You should stick with it, and so on. One of the basic knowledge in ethics is understanding ethical theories. Ethical theories provide part of the decision-making foundation for decision-making when ethics are in play. It means ethics needed. Ethical decision-making refers to the process of evaluating and choosing among alternatives in a manner consistent with ethical principles. يعني احنا بنستعمل الإثكس حتى نستطيع انه to choose alternative in manner consistent with ethical principles. But first we have to evaluate the situation. In making ethical decisions, it is necessary to perceive and eliminate unethical options and select the best ethical alternative. هنا تأتي الموضوع المهم انه سواء فكرت في مصلحة الطب، مصلحة المريض، مصلحة المجتمع. Always think you have to provide or to go with the best ethical alternative. Don't ever think that you will choose an ethical way to do things or to go with your healthcare. Then it is ethical. Ethical theories represent the viewpoints from which individuals seek guidance as they make decisions. Each theory emphasizes different points, a different decision-making style, or a decision rule, such as predicting the outcome and following one's duties to others to reach what the individual considers an ethically correct decision. This is part of some of these theories that we will be introduced to. Then, forms of ethical theories. For individuals, the ethical theory they employ for decision-making guidance emphasizes aspects of an ethical dilemma important to them and leads them to the most ethically correct resolution according to the guidelines within the ethical theory itself. إذن هي المسألة إنه for example four broad categories of ethical theories هذه broad لكن في غيرهم كثير طبعا. احنا بس بدنا نتعرف على هذول حتى نشوف ربما نستطيع انه نفكر بغيرهم ايضا. deontology اللي هي قائمة على الobligation based. utilitarianism اللي consequentialism. outcome based اللي قائمة على انه بدرسوا or they think about the outcome, they only think the outcome. Nevertheless, what the way or the method you go to achieve the outcome. Other theory is about right-based, your rights, patient's rights, and virtues-based, considering everything that you do is a virtue. It's an intrinsic thing built in your character. But most important, the principalism, which is about the four principles we will be talking about also. So I will tag them as other theories. Okay. So let's begin with deontology or obligation based duty based. إذا هي عادة أنا بحب أسميها obligation based لأنه most الكاركترستيك تاعها إنه بالفعل it's about obligation. The one who thinks about this theory things that it is obligation to in healthcare providers to provide the healthcare. So, the ontological theory underlines the importance of one's duties and obligations. إذن here about duties and obligations. أصل الكلمة ديون is a Greek word for duty. So, it's a duty based. This theory states that people should adhere to their obligations and duties when engaged in decision making when ethics are in play. Ethics are in play يعني موضوع الرعاية الصحية يتدخل في الإثكس أو مطلوب منه الإثكس، فبالتالي engage in decision. طب إمتى إحنا بحاجة إلى decision making؟ decision making ما هو مسألة الرعاية الصحية كطبيب كنيرس whatever you are doing your job، لكن when you face dilemma a problem or you face anything that needs this decision making, as I said before, one is refusing the operation despite it's a life saving. So what to do? Decision making. In many situations, you will make the patient sign on his responsibility, discharge, and so on. So decision making, it's about situations that need to think what to do. So this theory is about obligation. That's what ethics are in play. This means that a person will follow his or her obligations to another individual or society because upholding one's duty is what is considered ethically correct. إذن هؤلاء الناس إذا اقتنعوا بهذه النظرية، نظرية أنه it's my obligation، أنا ملتزم وعندي التزامات نحو مرضاي أني أقدم لهم the best. A person acts morally because he is required to, as a person, underlies the importance of one's duties and obligations. For instance, a deontologist, the person who thinks about duty or obligation, will always keep promises to a friend and will follow the law. A person who adheres to this theory will produce very consistent decisions since they will be based on the individual's set duties. إذن هو ينظر إلى المسألة بجدية كبيرة من وجهة نظره أنه I have obligations and I will adhere to these obligations. So, all persons, according to deontology, have certain obligations. These obligations are non-negotiable. They are constant. They cannot be bought off or disposed of. Rights, obligations, and justice are the focal points. Then, this is the focal point of this theory: obligations, rights, or justice. According to this theory, an action is morally good if it honors a given obligation which does not depend on the consequences of the action. طبعا هذه العبارة بين قوسين هي موجودة حتى تشير إلى مخالفة الثيوري اللي بعدها، لأن لها علاقة الثيوري اللي بعدها في الكونسيكونس اللي هو الأوتكم. regardless of the consequence, this person or this doctor or whatever is considering this an obligation, regardless of the outcome. So he or she will do the best or utmost to achieve better health. Such a theory entitles certain people or groups to rights or a claim to justice. Also, this theory stipulates duties that must be observed irrespective of their consequences. For example, legitimate rights must be respected and unjust action is prohibited. This is overall the obligation-based theory. نيجي الآن لهاي الثيوري اللي هي تتعلق predicting the consequence of the action. So I will do this action because I think it will lead to such consequence, or utilitarian or utilitarianism, call it whatever you want. These ethical theories are based on one's ability to predict the consequences of an action. They concentrate on value of well-being, happiness, for example, well-being, which may be analyzed in terms of pleasure, happiness, welfare, preference, satisfaction, uh, or the like. They accept only one basic principle of ethics, the principle of utility. I will use this as a mean to get pleasure, to get happiness, welfare, regardless of the method. The method may be unethical or not accepted to many situations or rules or whatever, but they will do it. To such people, the choice that yields the greatest benefit to the most people is the one that is ethically correct. The most people, it means that the majority, regardless of if this patient is not satisfied with such treatment or whatever intervention, but the doctor is thinking that the majority of people have benefits. Some unclear about this. When moral outcome is unclear, one must choose action that provides best predictability for good outcome. إذا هي اختيار الأكشن اللي بيعطي good outcome. زي ما حكيت إنه بيفكر بالاوتcome at the first step. I'm doing this for such outcome. I'm doing this because I will not let this girl to suffer from whatever, or this patient to suffer from whatever. And the best way is to let this patient use his right or her right to euthanasia, mercy killing, because there is no cure or whatever, cancer, terminal cancer. So the best outcome is let this patient kill himself or kill herself or be assisted. So these thinkings is really somewhat extreme. There are two types of this theory, the act and the rule. Act, it subscribes precisely to the definition of this theory. A person performs the acts that benefit the most people, regardless of personal feelings or the societal constraints such as laws. Wow. But the rule theory, part of this theory, considers the law and is concerned with fairness. So a rule utilitarian seeks to benefit the most people, but through the first and most just means available. Therefore, added benefits of rule utilitarianism are that it values justice and includes beneficence at the same time. إذن هي مجرد distinction between two types of this theory. One is about action or act. The other is about rule. So the act will give you a hint, this is benefit the most people, regardless of personal feelings. But the rule, fairest and most just mean available. Act and rule utilitarianism have disadvantages. Although people can use their life experiences to attempt to predict outcomes, no one can be certain that his or her predictions will be accurate. Uncertainty can lead to unexpected results, making the utilitarian decision maker appear unethical as time passes, as the choice made did not benefit the most people as predicted. So now we begin with a critique of this theory. And والله مش معقول انه انت بناء على الاكسبيرينس تاعتك you predict the outcome, لكن it might be not accurate. Another assumption that a decision maker must make concerns about her ability to compare the various types of consequences against each other on a similar scale, but comparing material gains, such as money, against intangible gains, such as happiness, is very difficult since their qualities differ to such a large extent. فبالتالي اللي هو comparing the various types of consequences لا ينجح بهذه الطريقة. الأكت utilitarian decision maker is concerned with achieving the maximum good. All right. Thus, one individual's rights may be overstepped to benefit a greater number of people. هذا اللي قلناه بالنسبة للأكت، لأنه هو يهتم ب greater number of people regardless of the feelings or the rights of the person, individual. In other words, ACT is not always concerned with justice, beneficence, or autonomy for an individual if oppressing the individual leads to the solution that benefits most people. فهي خلينا نسميها مصلحة الجميع فوق مصلحة الفرد، ولكن هذا يعني الكريتيك كثير مهم وكثير عقلاني. It makes sense about utilitarian regime, for example, اللي هو ينظر إلى مصلحة الجميع قبل مصلحة الفرد. A problem is concerned with immoral actions, لا أخلاقية. Suppose that, or the only way to achieve the maximum utilitarian outcome is to perform an immoral act such as killing one person to distribute his organs to several others who will die without them. So it seems that to say not only that such killing is permissible, but that it is morally obligatory and it's unaccepted. This is like fantasy. إذا خلصنا أول نظريتين اللي هن تقريبا بتعارضوا مع بعض، أو واحدة بتقول إنه it is obligation، والثانية بتقول لا هي دراسة الكونسيكونس، وبالتالي مصلحة الجميع أهم من مصلحة الفرد. هذا ما يميز الثنتين. نيجي للنظرية التي حددت 4 مبادئ four principles، وبالتالي سموها principalism, based on 4 fundamental moral principles developed in the 1970s by the American Tom Beauchamp and James Childress. It identified 4 primary principles as the following, اللي هم respect of autonomy, non-maleficence, beneficence, and justice. طبعا في several derivatives لهذه المبادئ الأربعة اللي بتفرعوا طبعا عن هذه المبادئ اللي هي veracity، راح نيجي لهم بالتفصيل فيما بعد. Fidelity, paternalism, privacy, confidentiality، وأيضا other rules such as informed consent to be applied to solve the contemporary ethical dilemmas. It is a framework for thinking about medical ethics and often forms part of the education for those coming into medicine. It is not intended to be a general moral theory, but rather aims to provide a framework to help those working in medicine to identify moral problems and to make decisions about what to do. By this or its Western dominated methodology، هذه غربية، الطب الغربي. Principalism is widely used as a starting point for practical ethical decision making in the clinical, technological, and epidemiological professions. هذه نظرية. نيجي أيضا للنظرية بتقول الفيرتشو بيز ثيوري، اللي هي لها علاقة بالفيرتشو، فضيلة أو يعني صفة معينة. The virtues are habits formed by one's personality, parental and societal training, and professional or other standards suitable to one's life choices and roles in society. In essence, virtue theory argues that all human beings have an inborn nature that tends to the good in moral actions, but needs molding and direction, and most especially repeated habitual action to refine that nature away from vices and unbalanced or inordinate behavior. إذا الفيرتشو موجودة، لكن بحاجة إلى تلميع، بحاجة إلى دايركشن، توجيه، بحاجة إنه الإنسان يتعود عليها أو يطلعها وتصبح هي سجية من خصائصه، تصبح a virtue، تصبح character of this person. In fact, virtues are defined as good operative habits that intensify the potentialities of human nature from its emotions to its intellect and will toward good actions. إذن هي الفيرتشو هذه شيء بنربيه nurture، هو موجود لكن احنا بحاجة انه nurture it by training، social training، ربما طبعا parental زي ما هم قالوا parental it's a personality، لكن parental و societal training تؤدي إلى أمور طيبة. Morally strong communities stress different virtues essential for a decent human society: courage, love, friendship, responsibility, truth-telling, faithfulness, and wisdom. أي بعض الأمور. This is to emphasize the individual responsibility for choosing the good in every situation. طبعا هي individual choice، يا إما بيمشي مع هذه الأمور يا إما يثور عليها ولا يتقبلها. To guard against a misdirected political system or a type of corrupted physician, certain core virtues are always necessary for any decent society. Physicians need additional virtues such as humility, opposite of arrogance, compassion, respect for good science, integrity. This theory of character of the physician was further developed by others such as Pellegrino and other authors. And now with rights-based theory. Rights in ethical theories are based on rights. The rights established by a society are protected and given the highest priority. Rights are ethically correct and valid since a large population endorses them. The basis is the rights of all parties, providers of healthcare and the recipients of it. The consumers have rights of autonomy, for example, privacy, confidentiality, information about risk, benefits, and alternatives of any kind of treatment or procedure. On the other hand, healthcare professional has rights that are stated in ethical codes concerning the healthcare. The right is a justified claim validated by moral principles and rules. فبالتالي الرايت بيزد هي جزء من التفكير الأخلاقي، وجزء لا يعني لا ينفصل ولكنه مهم جدا، لكنه لا يفسر كل القضايا اللي بتتعلق بالديسيجن ميكينج بناء على أخلاقيات المهنة الطبية or ethics and medical practice. Let's look at other ethical theories. Relationship-based ethics of care. It concentrates on the intimate personal relationships such as compassion, love. This implies caring for, emotional commitment to, and willingness to act on behalf of persons with whom health professionals has a significant relationship. It includes elements of trustworthiness and the quality of care itself. فبالتالي هي بتصير علاقة، لكن المفروض أن ما تتطور هذه العلاقة إلى شيء آخر، وإنما you are emotionally committed to act on behalf of this patient. طبعا هذا بتفرع عنه شيء آخر اسمه paternalism, which is about إنه I do that because I feel like a father that knows the best for his child. So that's paternalism. But as I said before, these are theories that try to give hints about how to do things with patients, especially if there is a situation that needs decision making. So if you go with the relationship based, it's not always in the best interest of the patient to do what you think is good for the patient. So the patient has the right to say no or whatever. Other theory is case-based. They call it casuistry or reasoning. The proponents of this theory focus on practical treatment of each case. It's about case-based. Proper judgment should occur when when health professionals deal with each case individually with all details and comparing the historical records of similar cases. إذا بتعاملوا بهذه النظرية إنه والله we did this with a previous patient, so it is okay and so on. So they compare cases or records. So let's talk about healthcare ethics. It's not a theory, like it is about guidelines, how to include a little bit of ethical thinking during healthcare practice. So, healthcare providers should adhere to a set of professional standards and guidelines to ensure the delivery of high quality care. So, I will highlight the high quality here because this is what it is about. It is a right thing to do, high quality care. It's about patient safety, ethical practices. These standards are essential for maintaining the trust and confidence of patients, families, and the broader community. While ethical theories may vary by country and healthcare setting, here are some common professional standards that should be implemented in healthcare practice. First, low clinical care standards. Always think about these standards. First, you have to adhere to evidence-based guidelines for diagnosis, treatment, and care. Always think about evidence-based guidelines. Continual monitoring and improvement of clinical outcomes. Think about it also. Prompt pain management and symptom control. Commitment to infection control and prevention measures. This is a clinical care standard. Patient-centered care. Respect for patient's autonomy and involvement in decision making. You have to always ask the patient what you are doing, or his or her uh, uh, agreement, consent, timely and effective communication with patients and families. Yes, cultural competence and sensitivity to diverse patient populations, compassionate and empathetic patient care in tandem with ethical obligation. Regarding the ethical obligations, you have to go with be compassionate and always think about this patient needs your care, needs your help, and be empathetic with the patient. Safety standards. Implementation of patient safety protocols, including medication reconciliation and patient identification procedures, reporting and investigation of adverse events if near misses, reduction of healthcare associated infections and other preventable harm, and effective management of medical errors and disclosure when they occur. طبعا الethical standards اللي هم الفور principles اللي هو beneficence, non-maleficence, autonomy, justice، وأيضا احترام أو protection of patient information, patient confidentiality, privacy, informed consent process for treatments, procedures, research, resolution of ethical dilemmas through consultation with ethics committees when necessary, and continuing education and competence, ongoing professional development for healthcare providers and co-workers, maintenance of licensure اللي هو الترخيص و certification requirements, monitoring of healthcare professionals' competence and performance to avoid harm, and documentation and record keeping, accurate, complete documentation, and also any follow-up visit, timely entry of patient information into electronic records, protection of patient records, compliance with data privacy regulations, teamwork, collaboration also, effective interdisciplinary collaboration among healthcare professionals, clear, open patient treatment communication, moral conflict among team members اللي هو إنه ما يصير في conflict, encouragement of a culture of mutual respect and group decision making, resource utilization and efficiency, responsible use of healthcare resources, including diagnostic tests, treatments, efforts to minimize healthcare waste, اللي هو الefficiency, monitoring and control of healthcare costs while maintaining quality care to promote health، اللي هو هذه خصائص حاجة مهمة جدا في الإثكس اللي هي الefficiency. هذا من حقوق الهيلث كير إنه يكون efficient. Patients and family education, providing patients and their families with information about their conditions, treatments, self-care, supporting patients in making informed decisions about healthcare, quality improvement, regular assessment of healthcare services, processes, implementation of quality improvement initiatives to enhance patient outcomes and safety, measurement and reporting of performance metrics. So these things that, if we think about them, they really are very good and excellent in maintaining the ethical guidelines, ethical thinking. When someone is saying, I will not do that, it is really unethical if you are a doctor or a nurse or whatever and not sticking or not committing yourself to achieve or to do these things. Ethical dilemmas may require an update to internal rules and work processes. This requires consultation with frontline staff members, the administrative body, and the legal team. The best way to handle ethical problems in medicine is to adopt the following. Provide regular refreshers on code of ethics and data privacy best practices. Allow for different staff members to come together to discuss the issue. Establish a clear chain of command when ethical issues need to be escalated or when group decision making is required. Create an environment where the patient's wishes are prioritized. This includes informed consent, reviewing questionable medication orders, and involving family members when appropriate. Employ ethics experts to work alongside medical teams or create ethics committees to review the decision-making process, patient rights, moral norms, and moral rights regarding the case. What are common ethical obligations facing medical doctors? Moral considerations that often arise at a practice or hospital include patient autonomy. يعني مش فاهمين الدكاترة أو طلاب الطب إنه المريض له حق الديسيجن. Informed consent, patient's confidentiality. شفتوا فلان شو صار معه؟ Patient's autonomy, professional and personal ethics, end-of-life care, resource allocation, cultural sensitivity, competing values, personal relationships. What's an ethical issue? An ethical problem definition, also known as ethical dilemmas or moral conflict, refer to a situation or conflicts in which there is a moral or ethical disagreement or uncertainty about what is right or wrong. These problems typically involve conflicting values, principles, or obligations, and they often require individuals to make difficult decisions or choices based on their sense of ethics and ethical theory. هذا هو تعريف ethical issue or dilemma or problem. تصير في conflict، تصير في uncertainty about what is right or wrong. فبالتالي الطريقة اللي حكينا عنها من قبل انك تجمع المجموع وتفكروا وتعملوا ويكون في ethical guidelines or protocols، وتكون الكود اوف ethics موجود دائما حتى يحمي الجميع. يعطيكم العافية.